Councils of Transportation and Traffic, and can be rest assured the awards are in good hands. Choose Rema Brains International School because we are highly qualified and dedicated with licensed teaching staff. We focus on holistic development, academics, sports, arts and technology, affiliations with renowned universities in the USA and Europe for our summer exchange programs. Language programs in French and Dutch are also taught. Innovative courses in robotics and coding. Enroll today and secure your child's future at Rema Brains International School. Spaces are limited, so don't miss this incredible opportunity. Visit us at www.rematrainingcenter.tech or contact us on 024-462-6836 or info@rematrainingcenter.tech. Rema Brains International School, where future leaders are made.
We have only one Ghana, and its prosperity lies in our ability and willingness to uphold our national values and identity. The values of respect, integrity, responsibility, patriotism, nationalism, humility, tolerance, and accountability must define us as a people. Our values, our passion. This message is brought to you by the National Commission for Civic Education, NCCE.
Transform your soul by tuning in to all the goodness on radio. Sweet Melodies 94.3 FM.
Locked on.
Health, they say, is real wealth, not pieces of gold and silver. Well then, let's get you healthy, shall we?
Stress is a precursor for some cardiovascular diseases.
Okay.
When asthmatics are stressed, they get attacks.
Okay.
So these are reasons why you shouldn't be stressed medically.
The diagnosis, symptoms, and treatment of various ailments expounded and demystified.
If you have peptic ulcer that is being treated, then you may want to avoid spicy foods because that increases the discomfort. Again, would advise that your meals are regular if you have peptic ulcer to prevent hunger pangs.
Okay.
So these are helpful lifestyle things.
Tune in to Doctor Who, our interactive health program here on Sweet Melodies 94.3 FM. Every Wednesday at 11 a.m. as our radio doctors dissect various topics pivotal to your health and well-being. Doctor Who. Saving every heartbeat.
Good morning, listeners, and welcome to Doctor Who, our health segment here on Sweet Melodies 94.3 FM. My name is Kwaku Sampson. Today I'm joined in the studios by Dr. Nabia Anin, our radio doctor here on Sweet Melodies FM. And we're discussing a very, very important and interesting topic today that will educate all of you out there. We're talking about miscarriages. Dr. Nabia here, welcome.
Thank you.
Good to have you back in the studios.
Yes, I'm glad to be back.
Okay. We will be opening the phone lines in the course of the program. You can call in with your questions or your contributions. Meanwhile, the text lines are open also. You can send in your questions to 0279-100400 or 0279-100600. We're discussing miscarriages today. Dr. Nabia, what is a miscarriage?
Good question. Miscarriage. Actually, it's also synonymous. So another term used to describe miscarriage is an abortion.
Okay.
Medically, we kind of use the words interchangeably, miscarriage or abortion.
Right.
But what it essentially means is the loss of a pregnancy.
Okay.
Usually we say before the 20th week of gestation.
Mm-hmm.
So if you lose your pregnancy or your pregnancy is threatened in any way before the 20th week of pregnancy, then we say that you are having a miscarriage or you have had a miscarriage or an abortion.
Okay.
Yes. That's
so is there a difference between miscarriages and abortions? Because I think people use them
Yes, yes. I think, typically we would say, or the layperson, when we say she's had an abortion, then it's usually referring to somebody who has actually gone to terminate the pregnancy.
Okay.
No, but medically speaking, it's actually the same thing. Saying a miscarriage and having an abortion really means the loss of the pregnancy. It could be induced or it could be spontaneous.
Okay.
Spontaneous, as in you didn't do anything. You lost the pregnancy.
Okay.
Or induced means you've actually gone to induce or actually artificially make it happen. Exactly. Yes.
Okay.
So it's really about the same thing, but I think locally we say an abortion for making it happen.
Okay. All right. So in that case, what are the causes of miscarriages? If you are not inducing it, then what could probably be the cause of a miscarriage?
Losing a pregnancy. Okay. So it depends on there are different things that can cause miscarriages.
Okay.
It depends on the gestational age. Now, gestational age refers to the age of the pregnancy.
Okay.
Now, if you are in the first pregnancy as a whole, can be divided into 3 parts.
Okay.
You talk about the first trimester, which is the first 13 weeks of pregnancy. The first 13 weeks of pregnancy.
Okay.
Then you have the next 13 weeks, which is the second trimester. That's from 13 weeks to about 26 or 27 weeks.
Okay.
Then you have the third trimester, which is from 28 weeks onwards. So we have pregnancy in trimesters.
Okay.
Now, for the first 13 weeks is the first trimester, and the first trimester has unique things that can cause, or there are certain things that can happen in that first trimester that can cause you to have a miscarriage.
Okay.
So causes of first trimester abortions or causes of first trimester miscarriages is what we are going to talk about first. Okay. Now, the commonest cause of a first trimester miscarriage is what we call genetic causes.
Okay.
About 75% of miscarriages that occur within the first 12 weeks are from genetic. That is inborn things. Nothing that has to do with anything you as a woman is doing or you as the dad did. Nothing like that. It's really inborn.
Okay.
There's genetic material that every fetus has from mother and from father.
Okay.
And sometimes that mix is just not compatible with life. So for a lot of people who have first trimester miscarriages, it's genetic.
Okay.
It's nothing to do with anybody.
Okay.
So that's the commonest cause.
Okay.
Then there are other things, infections, a very severe malaria, a very severe urinary infection, anything that can cause probably an increase in temperature can cause a miscarriage. Because when a woman's body temperature goes up, she has a fever, it causes changes in the body that can sometimes lead to a miscarriage. So an infection can cause that.
Okay.
Then there are things like abnormalities in the uterus, uterine abnormalities, things like fibroids. Fibroids can be placed in the womb at such positions where they affect the growth of the pregnancy, and that can also cause a miscarriage.
I see.
And then there are some other what we call anatomic abnormalities of the uterus. So sometimes you have a uterus that has 2 canals or 2 cavities, and that can also be another cause of a miscarriage. So for first trimester miscarriages. These are some of the causes, but the largest group is genetic.
Genetic.
Yes, genetic.
I see. Still here on Sweet Melodies 94.3 FM, we're discussing miscarriages or abortions today here on Doctor Who, our health segment. You can send in your questions if you have any to 0279 100400 or 0279 100600. That number is on WhatsApp, so you can send a WhatsApp to 0279 100 600. Someone says, can you please talk about the relationship between sickling and miscarriages? Okay, I think we did sickling. We've done it for
the last couple of weeks. Yeah. Well, there's no direct or very obvious correlation between a mother who has sickle cell disease and miscarriages. However, like I said, infections can cause miscarriages.
Okay.
If you are pregnant and you have sickle cell disease, just by the virtue of the fact that you have sickle cell disease, you are more prone to having very severe infections like malaria, typhoid. Any infection you get could be actually potentially more severe, and that can lead to a miscarriage.
Okay.
Not necessarily the sickling itself.
Okay.
Not necessarily the sickling itself.
Okay.
So, and then also there are some problems that with delivery. Like there are some people who their sickle cell genotype, they are SC. Now, if you are SC, there's a higher risk of placental, what do we say, insufficiency, and therefore there's a slightly higher risk of stillbirths in women who are SC and carrying pregnant babies till term. So as gynecologists, we watch out a little more for them towards the end of the pregnancy. But with abortions, it's not so clear.
Nimako says, can you please tell me the difference between abortions and miscarriages again? I just tuned in late.
Okay. Well, I would say there really isn't. There really isn't any difference from the medical standpoint. Sometimes we use the word interchangeably. Miscarriage, she's having a miscarriage, or she's having an abortion. Just that, like I said, locally, we tend to use abortion more for somebody who is having one, inducing an abortion. But really, medically speaking, it's really about the same thing. Yes.
Is there a relationship between diet and miscarriages during pregnancy?
Well,
No, please add your name when you send a message, okay?
Well, I not directly, unless you are starving. I mean, unless you are starving or something like that. I wouldn't say so. What I would say is that if you have a poor diet or your diet is not very balanced, then over the period of the pregnancy, you may have a baby that doesn't grow very well. So you may have low birth weight babies, or you may have babies. With time, the baby may actually die. But unless you are starving, really, I think that it's not likely that your baby is going to abort, or you're going to have a miscarriage because of your diet. Now, this comes with a little disclaimer. If, for example, you are diabetic, as you are a diabetic, we know that you are not supposed to eat certain things. Your diet has to be controlled because of the inability of your body to handle the sugar load. So for a diabetic patient, if you don't stick to the diet that you've been placed on, watching the carbohydrate intake, then your blood sugar levels can go very high, and that could be toxic to the baby and actually lead you to have a miscarriage. So maybe diabetes is one unique circumstance, but otherwise, if you are healthy and you're normal, a poor diet, a diet that is not balanced, will affect the baby, but more over the long term, and it's more likely to cause low birth weights, and maybe it can lead to fetal death, but it's not likely to happen within the first 20 weeks. And I said that a miscarriage is, by definition, loss of the pregnancy before 20 weeks or before 5 months of pregnancy.
Adra says, so please, does it mean that at some point in pregnancy you cannot lose the baby?
No, it doesn't mean that. What it means is that you can lose the baby at any point. But when we say you've had an abortion or you've had a miscarriage. Yes, when we say abortion, even for me, it's like you are committing. When you say you've had a miscarriage, we are talking about losing the baby before the baby is viable. Viability means that can the baby survive outside the womb on its own? So when you lose the baby before the baby can survive outside the womb on its own, then we say that you have had an abortion or you've had a miscarriage. You've lost the baby. Now, usually we say that after the 22nd week or 24 weeks in certain places, the baby can, technically speaking, survive outside the womb, technically. So we say that life outside the womb is possible after 22 or 24 weeks. So if you lose the baby at 26 weeks, for example, we would not say you have had a miscarriage.
Okay.
We would say that the baby, you had a fetal demise.
Okay.
We will not call it a miscarriage,
Okay.
because the baby could technically speaking have survived.
Okay.
And so, or the baby has life, a certain type of medical life. So we don't call it a miscarriage at 26 weeks or 28 weeks. You were 7 months and the baby died in there. We say you've had an intrauterine death.
Okay.
We don't call it a miscarriage.
Call it a miscarriage.
Yes. So if it's less than 5 months, if it's less than 22 weeks, then we call it a miscarriage.
Okay. Well, we have some more questions. This one says, "Hello, doctor. Please, we tried terminating our baby, but it didn't come, and now she does not feel any sign of pregnancy. But she checked today, and it was positive, meaning the baby is still alive. Doesn't mean the baby is hurt or something. Because I want to keep it now." Wow.
It's a difficult question to answer. First and foremost, we don't know how far along this pregnancy is or is. So I think that probably what you should do is to go back to your doctor. That you need a scan. An ultrasound scan will be able to tell whether the baby is alive or not, and how far along the baby is. As to whether the baby is well or not, it's difficult to tell. We would only be able to tell after the baby is born. But at least we'll be able to look at, we'll be able to do a scan and see whether the baby is alive or not. And then that's about all we'll be able to tell. Okay. Sometimes at about 20 weeks, we are able to also look at some of the vital organs of the baby. It's called an anatomical scan.
Okay.
When we do that scan, we look at the chambers of the heart, we look at the stomach, we look at the spine, make sure the baby has 10 fingers, 10 toes. So it's called an anatomic. We look at the anatomy of the baby.
Okay.
So another thing you can do is to have an anatomic scan done at about 22 weeks.
Okay.
And that will give you an idea as to, the structures and how the baby is doing. It will give you an idea. Okay.
David King from Dansman says, "Please, can abortions be caused by the kind of food you eat and drinks you take?" Okay, I think we've answered. I don't know if you would want to add anything.
No.
Okay.
Yes.
So we've answered this, David. Okay. I have a few more questions here.
Actually, let me just say this really quickly before. With first trimester, remember I said that genetics play a big role in causing a miscarriage. That's the commonest cause of a miscarriage is actually genetic.
Okay.
In the first trimester.
Yeah.
So it's important for us to know this, because I have a lot of patients who come in and sometimes feel guilty because they think that maybe something they did or did not do was the reason for their miscarriage.
Okay.
So I just want to emphasize again that the commonest cause in the first trimester is genetic.
Okay.
It has nothing to do with what you ate, where you went because you were working, and all of those things. It's the commonest cause. Like I said, there are other things like fibroids, infections, and those things that can cause it. But this is the commonest cause.
Okay. Well, the one who sent the message about the pregnancy they tried to abort and didn't work. This one, he says it was 1 month. Okay, so I don't know.
Yeah, so like I said, to go, to progress further from here, I think that it would be best that you see your doctor, get a scan done. If the pregnancy test is still positive, get a scan done. It would tell you how far along the pregnancy is, if the pregnancy is still viable. That is, if there's a heartbeat and everything. And then you take it on from there.
Okay. All right. Na says, "Please, is it true that some sex positions during pregnancy can cause abortion?"
Well, not really. We say that generally, maybe what I should say is that sex in general does not cause abortions.
Okay.
I have a pregnancy class I teach at the hospital that I am in, and one of the common questions that comes up in the pregnancy in the class is that, am I going to have will I have a miscarriage if I have sex? Or some women actually say that they choose not to have sex during the pregnancy, especially the early stages, because of fear of causing an abortion.
Okay.
And my answer to that, and what I'm saying now, is that sex generally does not cause abortions.
Okay.
The cervix, is very in a early pregnancy is typically speaking about 3 centimeters long. The cervix is the lowest portion of the womb.
Okay.
It's about 3 centimeters long. It's very thick. The womb or the uterus where the baby is has very thick walls. So sexual activity does not in any way affect the baby. People feel that during sex, because of the movements, the baby may be shocked out of the womb or something. I don't know. Poked out of the womb. I'm not too sure. They feel, but it's quite insulated.
Okay.
So I reassure people that usually there's nothing to worry about having sex in pregnancy. There are a few exceptions to that.
Okay.
If you are bleeding, you've had some bleeding in the early stages of your pregnancy, we advise you not to have sex.
Okay.
It's not the sex that is causing the bleeding, but if you are bleeding, you are having what you call a threatened abortion. I'll talk about that in a minute.
Okay.
Then we don't want you to provoke it and make it worse. Okay. So we would say that do not have sex during pregnancy. A little later in the pregnancy, if your water bag has broken, your membranes have ruptured and your water bag has broken, we also advise you not to have sex. If you've had a difficulty conceiving, you've been trying to conceive for 6 years, 7 years, whatever. You've had some difficulty, anything longer than 2 or 3 years, and you are finally pregnant. Just to play it safe, we also advise that at least for the first 3 months, you don't have sex.
Okay.
But generally, sex in pregnancy is okay.
Okay. Okay. All right, still here on Dr. Who, our health segment. We'll be opening the phone line shortly, but you can send in your messages to 0279100400 or on WhatsApp 0279100600. We're discussing miscarriages today here on Dr. Who. Now, Dr. Nabia, we talked about the definition of miscarriages, or we've established the difference between, I don't know if I should say different because they are technically the same, but
yes.
I mean, in the use between abortion and miscarriages, and the fact that it's earlier in the pregnancy.
Yes.
24 weeks, you said, or 27?
No, about 22. 20 to 22 weeks.
Okay.
If you any bleeding, any bleeding that can potentially lead to the loss of the pregnancy, 22 weeks and below.
Okay.
We'll term it some kind of abortion.
Okay.
Now, or miscarriage. Now, let me just clarify this. Medically speaking, or for the layperson, when you say you've had a miscarriage, it means you've lost the pregnancy.
Yes.
Or if you say you've had an abortion, it means you've lost the pregnancy. It could either be you've lost it spontaneously, meaning that you had nothing to do with it, you lost it,
okay,
or you induced it. Okay. Now, but besides that, we also describe something. There's something described as a threatened abortion.
Okay.
Threatened means it's as if the baby is trying to abort.
Okay.
Now, we use that term for people who are bleeding. Maybe you are 10 weeks pregnant and you went to the bathroom, you wiped, you noticed some blood, you come to the hospital, we check it. You have not lost the pregnancy, but it's as if the pregnancy is sitting on a wall. Should it fall to the left side or right side? It's threatened.
Okay.
So that's why we call it a threatened abortion.
Okay.
You have not lost it yet, and you may never lose it, but you are bleeding. Just the fact that you are bleeding in the pregnancy, we say is threatened.
Okay.
So typically, if we saw a patient like that, you came in, you are bleeding, we would examine you. If the mouth of your womb or the cervix is beginning to open, it's actually opening, then it looks like you are more likely to actually go ahead and completely lose the pregnancy.
Okay.
But in some instances, you may bleed, but it doesn't lead to a loss of the pregnancy.
Okay.
Do you understand?
Okay.
So you may actually bleed. It doesn't lead to a loss of the pregnancy. You could bleed from, even though you're bleeding, you may think that it's from the womb, but sometimes even an infection, a vaginal infection could cause you to bleed. You could have a cervical infection, an infection of the cervix could cause you to bleed. Sometimes very vigorous sexual activity could cause you to bleed. Various things. So if you came in and we examined you, we'll do a scan. And the scan may show that the baby is fine. Yes, you're bleeding a bit, but the baby is fine. So we'll then say that you have a threatened abortion.
Okay.
And then usually the treatment of that is really just bed rest.
Oh, okay.
There's no medicine per se. If it's an infection, obviously, we'll treat an infection. But other than that, we normally say that bed rest, will normally give you some days off from work. Go home, take some days off, take it easy. And usually, with time, it just, the bleeding stops and the pregnancy continues.
Okay.
Occasionally, the bleeding starts, the rest doesn't stop it, and it will proceed, it will progress, and you would lose the pregnancy. But there's really no medication per se to give for a first trimester. First trimester is less than 12 weeks. If you are bleeding in the first trimester, really, there's no medication per se. Why do I say that? Because I said most of the causes of loss is genetic. And that's why if you were bleeding, there's not a whole lot we can do. Apart from saying that, listen, take it easy, don't go to work, no sex, bed rests, no heavy activity. And for most of the time, if it's not a genetic cause, it will stop. The bleeding will stop and the pregnancy will continue.
Okay. Well, now that you've mentioned, you've talked a bit about how to tell that you've had, bleeding is one, but not all bleeding is a miscarriage.
Because the miscarriage itself is a loss of it. But before you lose it completely, you will bleed. It's bleeding, then finally you've bled all the pregnancy out. So it's kind of it's like a progression of events. It will normally start with a bleed. So when you bleed, we would say as doctors that you have a threatened abortion. Then we will do a scan and everything. Sometimes we will do the scan and see that, well, you were 8 weeks pregnant. You said you bled at home. When we came and we did the scan, we realized that the baby is no longer there, unfortunately. So then we will say that you have had a miscarriage. Or you have had an abortion, a spontaneous abortion. But on the other hand, you would come, you said, I was bleeding yesterday. We do the scan, and the baby is still there. The heartbeat is still there. So then we say you are having a threatened, it's like you are threatening to abort. You are attempting to abort, but you have not aborted yet. So we just call it a threatened abortion. And the treatment of that is bed rest for the first trimester.
Because I was going to ask how you would know. Are there any other signs aside the bleeding that can tell you? I mean, maybe other bodily signs or something? Cramps.
So if you're having bleeding and then you notice that you are having some crampy, it's like menstrual cramps together. Not cramps alone, but if you bleeding and cramps usually suggest that there's something going on. You are threatening to abort. So like I said, you still should come to the hospital. Regardless. We would normally give you bed rest. We tell you to drink more fluids. We may admit you, or depending on what stage of the pregnancy you are in. Now, if it's first trimester, there's no real medication that we can give to stop it conclusively, like this is going to stop you from miscarrying. It's bed rest. There are a couple of medications that we can give to reduce the cramping, which we sometimes do. But we have to balance that because in the first trimester of pregnancy, the baby is forming. So we have to be careful about the medications we give. Because some medications could be, it will stop, it could stop the contractions or the cramping, but it could have an adverse effect on the baby because the baby is so young. So there's a balance. We try and stop it, but next thing you know, the baby is alive, but it now has some problem because of the medication that you gave. So in the first trimester, we are very careful about the medications we give. So if we can stop it with some fluids, bed rest, we tend to do that. Now, if you happen to come in the second trimester, second trimester is from 13 weeks or from 3 months going. The causes of bleeding then or cramps then could be still is threatened. But in that case, since you are past 13 weeks or since you are past 3 months, if we examine you and we notice that the cervix is beginning to open up a bit, sometimes we are able to do what we call a cerclage, where we literally take a piece of suture material and we kind of tie the mouth of the womb or tie the cervix by a procedure called a cerclage, so that the thing that was beginning to open, because the cervix will have to open before what is in there, which is the baby, comes out. So if you are able to tie the opening of the cervix or tie the opening of the womb, which is called the cervix, if you're able to tie it off, then in most instances we are able to, in a sense, stop the opening and the miscarriage from happening. But we cannot do that less than 12 weeks. So first trimester, we don't do that. We can do that from about 14 weeks onwards. If we notice that the cramping or the light bleeding is leading to the opening, then we can sew it closed. And a lot of the times we may be able to prevent the miscarriage from happening.
Phone lines open now. You can call into 0302-232350 or 0302-224-111. That's 0302-232350 or 0302-224-111. Calling with your questions, contributions into the program today. We're talking about miscarriages. Question here says, Doc, we married 10 years ago. My wife got pregnant this February but lost it 2 months later. But never since she is menstruating, it takes 2 to 3 weeks before it stops. Is it normal? Okay, I'm not sure if I understand.
It sounds like since then, sounds like since the miscarriage, when she bleeds, it
takes 2 to 3 weeks before it stops. Is that normal?
No. First, I'm sorry to hear about the loss after 10 years. I think that generally speaking, a period should last anywhere from 3 to 7 days. So if you are bleeding for 2 to 3 weeks, it's a little on the long side. She lost the pregnancy in February. We are in July. So I would expect that any effects of the pregnancy should have worn off by now. So I would expect that her period to go back to normal, which is having them last for anywhere from 3 to 7 days. So if it's lasting this long, then I think you should seek medical attention.
All right. I'm sure your question has been answered. This is Theo. He says, hi, please, I traveled. I've not been listening for some weeks. I learned you have talked about sickle cell. Is it possible to get the CD? Yes, you can call after the program on the lines I gave earlier, and you'll be sorted out. This is Rita. She says, so what's the difference between stillbirth and miscarriages?
Well, stillbirth, again, like I said, the miscarriage or abortion, what distinguishes it from, let's say, stillbirth is the gestational age. So if you lose a baby before 22 weeks, that is 5 months, you lose a baby before 5 or 5.5 months, then we say you have had a miscarriage or you've had a spontaneous abortion. If it's after that, then we'll say that you've had a stillbirth, or an intrauterine death. There are different terminologies. We'll say intrauterine death. If it was 7 months and the baby was born not alive, you've had a stillbirth. It was 32 weeks, that's 8 months, it was born not alive, we'll say you've had a stillbirth at 32 weeks. Yes, but if it's less than 5 months or 5.5 months, then we call it an abortion or a miscarriage. And the reason that the distinguishing thing is the baby's ability to survive on its own. So it's thought that if you had a baby after 22 weeks or 24 weeks, the baby, technically speaking, can live outside the body with, of course, sophisticated help.
Okay.
The baby's not going to be able to breathe on its own and everything, but the lungs would have formed, the brain is formed, the heart is formed, all of those things. And the baby, with a little support, can live outside the body. And therefore, medically speaking, it is thought that the baby is viable after 24 weeks.
Okay.
So if the baby dies after 24 weeks, then we say the baby died, we say you had an intrauterine death or a stillbirth. Okay, that's after 24 weeks because the baby is viable. Now, if you lose the baby before then we say you've had an abortion, because medically speaking, we say that the baby is not we cannot do anything about this baby. The baby doesn't have the lung tissue support. It doesn't have the chemical support to make this baby live. And therefore, that's the distinguishing, the gestational age distinguishes between what you call an abortion or a miscarriage and what you call a stillbirth later on.
Okay. All right. So phone line still open. You can call into 0302-232350 or 0302-224-111. Text lines and WhatsApp lines also open. Text lines are 0279-100400 or 0279-100600 for WhatsApp. That's 0279-100-400 for regular text, or 0279-100-600. Please, are there any medications that can cause abortion during pregnancy? Can you name some?
Well, no. I mean, there are I won't say medications. You see, when we take medications that we take antibiotics, we take painkillers, we take fever reducers, we take something for diarrhea. All those medications have, if you go through it pharmaceutically, you realize that they would tell you that this medication is safe in pregnancy. There's some medications that are known to be toxic in pregnancy. It's a whole range of medication. So it's difficult to say that this one or this one cause a problem. Now, what the doctor would have to determine, most of the medications that are out there are not known to cause a definite maybe miscarriage, but they will tell you that the benefit of the medication, given the medication, should outweigh any risk you have. So, for example, let's say you're having bad diarrhea. Now you're having diarrhea. You've gone 15 times this morning. Now the benefit of giving you Imodium, for example, which will stop the diarrhea, should outweigh any possible risk. Now, if I don't give you the Imodium and you've gone 15 times, now you are virtually collapsed. You are about to die. Do you understand? So it's important at that point for me to save your life, to give you the Imodium. And so I will give it to you, even though I may not know whether it could affect the baby or not. Now, Imodium doesn't. I'm just using that as an example. Imodium doesn't cause abortions. But I'm saying that for most medications in pregnancy, the doctor has to answer this question. Is the benefit of giving this drug much higher than the risk if I didn't give it? Do you get it? So that's why people come to the hospital, for example, and say, I'm vomiting. I'm pregnant, I'm vomiting. Typically, I will not give you any medication. I would advise, a bland diet, maybe ginger, which is a natural supplement, is not going to cause any problem. I'll say, avoid foods that make you nauseous, avoid oily foods, eat things like brown bread, things like that, eat small frequent meals. These are natural things that you can do to reduce the vomiting and the nausea. I would not firsthand say, go and take this medication, because even the effect of the medication on the baby, you don't know. You don't know. The manufacturer would just say, be cautious in pregnancy. Most of the drugs out there, the manufacturer says, be cautious in pregnancy. And so I would only give you this medication to stop your vomiting if you are vomiting so much that you have lost weight, you are so weak, if I don't give you medications, you could even actually pass out and then die. So I have to give you something, And so as for drugs, to say that, is this drug not good in pregnancy? It depends. That's really the answer. It really depends. If it is of benefit to the patient, you have to give it. If it is not, I wouldn't give it.
Okay, this one says, please, can constipation during pregnancy cause abortion in any way? Maybe when you're trying to go to the loo. Okay,
no. And she's probably thinking that maybe you strain. No. Like I said, the baby is very well protected in a thick muscle. So even if you strain a lot, it's not likely to cause.
This one says, is it possible to have white when pregnant? And can I have sex in my third trimester?
Is it possible to have
white?
Yes, white is a candida. It's a type of vaginal infection caused by candida. Candida is a fungus, and yes, you can get white. Actually, it's quite common in pregnancy. Yes, quite common. So you can get it. It doesn't usually. It presents by itching. Women who complain of an itchy, whitish vaginal discharge, which can easily be treated. It usually has no adverse effects on the baby, but we just treat it.
Follow-up says, please, how do I treat it?
Yes, you see the doctor. We'll give you something to treat it with. Yes, because we have to. The reason why, again, I'm not giving a general, you treat it this way, is that it's not every discharge that is white. Because you can have a type of vaginal discharge which may look white, but depending on certain characteristics, does it have an odor? Is it smelly? How long have you had it? Is it itchy? What is the color? Are there other symptoms associated with it? May suggest to me that it's not just candida or not just white. It could be white with something else, or it could be something else completely. So I would say that especially if you are pregnant, don't treat these types of infections by yourself. See a doctor, get examined, or let the doctor ask you questions that will help the doctor determine whether what kind of treatment you need.
She's still typing. I'm sure there are more questions, but she says,
and you can have sex.
Yes,
you can have sex.
Trimester.
Yes, you can.
All right. Let's do a few more questions here. This one says, hi, is it true that there are some medications that when a man takes and has sexual intercourse with a pregnant woman can cause miscarriage? This is Theo.
Not that I know of. No.
The man taking the medication
and causing a miscarriage in the woman. Hey.
That's a conflict.
It's serious. No, I don't know of that. I don't know of that.
Okay, Theo. So there's no known such. Okay, I think we've exhausted our questions.
Yes. The one thing I would say, though, it's that I think we are almost out of time. But
yes,
what I would say is that caffeine it's not a drug or not medication per se, but I would say that women who drink a lot of coffee, alcohol, those two things, and cigarette smoking, they are not drugs in a certain way, but they are things that we ingest, and therefore you could look at them as some kind of medication for those who take it often. And so those three things can cause miscarriages. So coffee, heavy coffee use. There are some people who drink a lot of coffee. I would say that if you are pregnant, especially in the first 3 months, you shouldn't drink more than a cup of coffee a day. Regular coffee, not espresso. Espresso coffee is like very concentrated coffee. Stay off alcohol completely and no smoking, because the three of them can definitely cause miscarriages. And when it comes to smoking, even smoking from secondhand smoke, meaning that you don't smoke, but your partner smokes, or you're in an environment of smoke, that can also lead to miscarriages.
I see. But Dr. Nabia, just to wrap up, so what happens after a miscarriage? Is there hope of another pregnancy? What should you do? What should you not do?
Yes. I think that's the good news is that one miscarriage doesn't mean that you can never have a baby again. You can, depending on the cause of the miscarriage. Like I said, the first trimester miscarriages are usually genetic. And the fact that it didn't mix well the first time doesn't mean it wouldn't the second time. So most of the time, you're able to conceive and carry the pregnancy. If it was an infection, usually it would have been treated and it will not recur the second time. One of the causes of miscarriage is we didn't get to talk about that. Maybe next time. Remember, I said those in the second trimester, sometimes the womb starts to open up, and the cervix, we can actually we can tie the mouth of the womb with a special suture material known as a cerclage. If you have that type of thing causing a miscarriage, then what we can do is that in subsequent pregnancies, assuming you lost the pregnancy, maybe at 18 weeks, then in subsequent pregnancies, what we will do is that around 14 weeks, we can actually sew or stitch up the mouth of the womb to prevent what happened at 18 weeks from happening again. You know, but other than that, I would say that one miscarriage doesn't mean another miscarriage. And so try again. If you've had 2 or more miscarriages, you should see a doctor to investigate. If there's something that can be detected to prevent miscarriages, we'll detect it and help you out.
All right. Thank you so much, Dr. Nabia. It's been great having you here for this discussion. Listeners, you've been listening to Dr. Who here on Sweet Melodies 94.3 FM. If you want to contact Dr. Nabia after the program off air, you can do so on 0200 182692. Okay, that's 0200 182692. The number again is 0200 182692. Same time next week, God willing, we'll be back with another interesting discussion here on Doctor Who. Thank you once again, Dr. Nabia, for coming.
Thank you.
My name is Craig Sampson. Have yourself a blessed afternoon, listeners. We'll catch you later.
Sweet melodies, sweet melodies, 94.3 FM.
Sweet Melodies, 94.3 FM.
If you got a God-sized problem, He can solve them. Yeah. There's just some problems only God can fix. If there'll be some moments that just don't make sense. I've seen it happen time and time again. There's just some problems only God can fix. Oh,
There's just some battles flesh and blood can't win. There'll be some moments that just don't make sense. I can't see it now, but I'm still convinced that there's just some problems only God can fix. Not by power, not by might, but by the Spirit of the living God. Not my battle, not my fight, but by the Spirit of the living God.
the Spirit taking care of that problem. He's taking care of that problem. Oh, I've seen a breakthrough that I can't explain. Oh, I found the healing hidden in my pain. I know a dead man that was once a grave.
I've seen some breakthroughs and I will again. Not by power, not by might,
Come on.
but by the Spirit of the living God. Not my battle, not my fight, by the Spirit of the living God. By the Spirit of the living God.
My fortress, my refuge, still a strong tower, still a strong tower. My It's still a strong tower, still a strong tower. For the name of the Lord is still a strong tower, still a strong tower. I find my safety in Him, He is still a strong tower, still a strong tower. I know where to go, I know where to go, I know where to hide, I know where to hide, my hiding place. He's still a strong tower, He's my hiding place. He's still a strong tower, He's my hiding place. He's still a strong tower, still a strong, He's my hiding. I know where to go, oh no, He's my hiding place. I know where to go, He's my hiding. Oh, I'm safe here. Oh, He's my hiding place, hiding place, hiding place, hiding place. He's my hiding place. He's a hiding place. I know where to go. I know where to run. He's my hiding place. Oh yeah, yeah, yeah. Oh yeah, yeah, yeah. Come on, say it one more time. It's not by Keep listening to radio, Sweet Melodies Radio, 94.3 FM, radio, enjoying the word, anointed music too, sweet melodies, all day through.
Good afternoon, it's midday. Welcome to Sweet Melodies 94.3 FM. You're listening to our major news bulletin. We're broadcasting live from 111 Parlors Loop, North Kanishi. You can listen to us online on www.sweetmelodiesfm.com, on Radio Garden and on TuneIn. Join us at Sweet Melodies FM. My name is Anakwe Kwampofo. In this edition of the news, the Electoral Commission says we are committed to peaceful and fair elections. NAPO says give us another term to complete our projects. In international news, Kremlin says Moscow will respond if Kiev uses US ATACMS missiles to strike Russia. Hanoi flooded by swollen river as Typhoon Yagi leaves 155 people dead. In sports news, CAF withdraws approval for Baba Yara Sports Stadium. And news now in detail. Starting off in local news. The Electoral Commission has reiterated its commitment to ensuring peaceful and transparent elections in the upcoming December general polls, noting that its credibility is at stake. Speaking in an interview, Dr. Eric Bosman Asari, Deputy Chairperson in charge of Corporate Services, highlighted the Commission's determination to uphold fairness throughout the electoral process. Dr. Asari assured the public that the EC is dedicated to maintaining the highest standards of electoral integrity and will not compromise on transparency. He emphasized that the Commission is closely